my name is Margaret Boche, and today I'm going to tell you how generic medications are underrated. When you go to the store and you have a headache, would you rather buy Advil for $7.99 or the generic equivalent Equate, which is a Walmart brand, for $2.48? They both contain 200 milligrams of the non-steroidal anti-inflammatory drug ibuprofen. So why would you pay 3 times as much for the Advil when you can get the Equate and cure your headache the same way you would with an Advil? Generic medications are often overlooked because patients are afraid of them. They think that they are poorly made, that they aren't as strong, or that they don't work. But those are all false claims. Generic medications are actually better than brand name medications. They all have that identical active ingredient. They have the same form, strength, and route of administration. They cost less money, and they are just as effective. The FDA, or Food and Drug Administration, requires the generic medication to have the same active ingredient as the brand name medication. The active ingredient is the one that's doing the work, that's actually reducing the fever or raising the blood pressure up. It's the one that matters. The other ingredient is just fillers for the medication, and they aren't as important as the active ingredient. For example, Augmentin, an antibiotic, contains 875 milligrams of amoxicillin and 125 milligrams of clavulane, and its generic equivalent, amoxiclav, contains the same 875 milligrams of amoxicillin as well as the same 125 milligrams of clavulane. So you can see in those two drugs that the FDA requires the active ingredient to be the same. The form, strength, and route of administration are all required to be the same by the FDA as well. The form includes the way that the medication is made, for example, a tablet, a capsule, a cream, or a suspension, and also the way the medication is released, for example, extended form or sustained form. The strength also has to be the same as well, whether it be a percentage of the medication, a microgram, milligrams, grams, it all has to be the same as the brand name medication for the generic equivalent to be approved by the FDA. And lastly, the route of administration has to be the same. If the medication is a tablet taken by mouth, then its generic equivalent has to be the tablet taken by mouth. Or if it's a topical, an eye ointment, that all has to be exactly the same, the way the patient is taking it. For example, the benzodiazepine, an anxiety medication, Xanax, XR 1 milligram, has a generic equivalent of alprazolam, ER 1 milligram. They both are tablets, they both are extended release, they both contain 1 milligram of the active ingredient alprazolam, and they both are taken by mouth. Another thing that comes to mind with generic medications is the cost and why they are so much lower than the brand name medications. These are a lot of reasons that the generic medications are cheaper than the brand name. They don't have to go through the costly experiments, approval, and advertising that the brand name has to go through. The generic doesn't have to go through any experiments because it's already been approved and done by the FDA. So the approval process is way less strenuous for the generic than it is for the brand name. They also do not have to advertise the medication because it's already been advertised as a brand name, and when they go to the pharmacy, they can just ask for their generic, or if there's not a generic equivalent, then it just won't be filled. Companies also have competition between themselves with driving down the price of the generic to the least they can, because pharmaceutical companies want to buy the generic from the company that has the one that costs the less for them. And lastly, insurance companies usually prefer the generic medication. The generic medication costs less for the insurance company, and then it'll cost little to no money for the patient. The brand name medications cost a lot more and usually are not on the formulary for the medication or person's insurance, or they cover some of it, but they don't cover enough, and the patient still has to pay a lot out of pocket. Lastly, the effectiveness is always considered when people are comparing generic and brand name medications, and they are just as effective. The FDA once again requires there to be the same amount of the medication in the blood and the same amount released in the blood between the generic medication and the brand name. Also, any adverse effects that are complained about by the patients, whether it be brand name or generic, are all reported to the FDA, and the medication is taken into consideration about why the adverse effects happen and what they can do to fix it. So as you can see, the FDA requires the generic medication to be the bioequivalent, which means it has to have the same active ingredients, form, strength, route of administration, and those all are considered when having the generic medication come out. Also, they are 80 to 85% less than the brand name medication, so that's less of a cost for the patient, and they both are just as effective. So next time you decide to go to the store and grab an Advil, why don't you just get the store brand ibuprofen that will do the same thing and will cost less for you, and save that money for something else. Thank you. And those are my references. Thank you.